Hello, everyone, and welcome to OncoDaily. I'm Sergey Badalyan, a medical oncologist from OncoDaily, and now I'm joined by Dr. Catherine Lam. Thank you for joining me for this conversation. And we are going to discuss about WHO Global Initiative for Childhood Cancer. And can we start? So please, Dr. Catherine Lam, briefly introduce yourself for our audience.
Very nice to be here. I am Dr. Catherine Lam, a pediatric hematologist-oncologist, director of the Health Systems Unit and the WHO Collaborating Center for Childhood Cancer based at St. Jude Children's Research Hospital, USA.
Thank you so much, Dr. Lam. To set the scene, could you please briefly explain what WHO Global Initiative is for childhood cancer and what kind of global impacts do you have?
We're very delighted at St. Jude Children's Research Hospital to have partnered with the World Health Organization to launch the Global Initiative for Childhood Cancer back in 2018. This is really a global initiative engaging all partners around the world so that we can aim to double the survival rates of children with cancer and reach at least 60% of a survival rate for the common cancers and decrease suffering for all. We do this by applying the CureAll framework so that we can really look at broader aspects of systems strengthening so that childhood cancer is not seen in isolation, but we can really work together across all sectors, across all groups to make the outcome improvements that are so necessary to reach children and adolescents around the world.
Perfect. You mentioned your how can I say it? The collaborators or the partners, yeah. Okay, so you mentioned your partners and you also have several partners around the world, including Armenia. Could you please tell me what were the driving causes to partner with Armenia and how can Armenia benefit from it? And why is it a strong collaboration force with WHO as well?
So St. Jude became the first and only WHO collaborating center for childhood cancer in March 2018, building on our ongoing collaborative work. And with this, as we expanded to the Global Initiative for Childhood Cancer that is now being implemented with many partners around the world, including International Society of Pediatric Oncology and Childhood Cancer International, this has active engagements across 87 countries in all 6 WHO regions. And this means in many instances, in over 50 countries, in fact, at the moment, we have ministry support so that they're formally engaging country teams as part of this global initiative for childhood cancer, including Armenia. So Armenia, as a ministry-led team, actively worked with WHO regional offices and headquarters to define their commitments and their engagements to apply the CureAll framework so that it could actively benefit the children and adolescents with cancer that are being seen here. And so that's why it's a building platform about bringing all hands in, especially with ministry leadership, so that it's not one individual clinician or one individual foundation, but all partners seeing how CureAll can be implemented.
Thank you so much for your explanation. And what kind of economic impact such an initiative can have on a country or the regions that you're working with?
Based on our work as part of the Lancet Oncology Commission for Sustainable Childhood Cancer Care, we know that every dollar invested in childhood cancer control can generate $3 in return. And so we really see this as something that's very critical, that we don't look just at one isolated component of childhood cancer care, but comprehensive management. And now, as part of the Global Initiative for Childhood Cancer, thanks to all the country teams that are reporting progress to the CureAll Progress Dashboard, we see that more than 500,000 children are already being reached through CureAll efforts. And we look forward to many more, as our overall target is to save 1 million more children by 2030.
Excellent. Do you have anything to add about the CureAll framework or the initiative that you somehow missed in your explanations? Like you can share more projects or the plans that you have with our audience.
We look forward to celebrating another CureAll Progress showcase this February as part of International Childhood Cancer Day. And we very much welcome all interested collaborators to join us for the next 4th cohort of National Cancer Control Planning, integrating children, adolescents, and young adults. So the program is called NCCP iCAYA, and it's very much about how country teams who are led by ministries can be part of a 7-month process to apply the CureAll framework in their daily national programs, in their legislation, and in their policies, so that rather than just looking at a piece of framework or principles on paper, country teams are actively exchanging insights over 6 months of a closed cohort dialogue and then a 7th-month open capstone to exchange lessons learned. And we actively welcome those that are practicing in adult oncology, those that are in leadership and administration, those that are working more broadly in public health, who have insights to lend to how we can integrate and join forces to see how we can strengthen systems not only for children and adolescents with cancer, but apply this CureAll approach to really benefit how things are working for cancer control, for non-communicable diseases, and for other catastrophic conditions. We're very pleased to announce that the 4th cohort of National Cancer Control Planning Integrating Children, Adolescents, and Young Adults, the NCCP iCAYA program, is now open for applications. So applications will close at the end of February. And over the past 3 years, we've been delighted to welcome 70 country-led teams with ministry support from 39 countries from all 6 WHO regions. And we look forward to having many more partners to join us, because we know that national cancer control planning is something that involves everyone. And we know how important it is to plan ahead, especially with all the changing and dynamic needs of cancer control and systems. And this is part of our broader efforts, so that country teams are coming together to apply practical solutions with evidence, with clear resource-backed frameworks, so that we can integrate the CureAll framework, which is part of the Global Initiative for Childhood Cancer, in real ways across diverse settings. So please feel free to join us. Individuals may apply, and we will give feedback to the country teams so that you can form a ministry-designated team in time for the next cohort with the open capstone in September. Thank you very much, everyone, for contributing. And we've been delighted to have expertise from across all the regions, including here in Europe, from the teams in Armenia and Kyrgyzstan and Uzbekistan and Moldova.
Thank you so much for joining me in this conversation. Yeah, I wish you all the best with your initiative and the framework. Yeah, thank you so much.
Thank you so much.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.